Hi, my name is Dr. Jeff Jacobson and I live in Hashmonaim. I'm representing the face of medicine here in Israel. I was born in San Jose, California and went back east for college, medical school where I met my wife, and as well as 2 residencies. We lived in Cleveland, Ohio for 6 years before making Aliyah. Acclimation was not easy, but we managed quite well with the help of our fellow Anglo-Olim, as well as some native-born Israelis as well. My credentials as a physician and a specialist were recognized by the Ministry of Health after some red tape and observatory period in a state hospital for several months. I stayed on at that hospital and after several years was made head of the pediatric imaging unit. My workday at the hospital starts off reviewing the previous night's films with emergency room physicians and our residents. I then perform fluoroscopic exams or perform or check ultrasound exams and read the x-rays, CTs, and MRIs on the children from the hospital from that day. Fridays are a short day in Israel, and if I'm not working in the hospital, I often perform teleradiology covering hospitals in the Philadelphia area during their night shift. I love my job, and I feel that every day I'm making a contribution to medicine here in Israel, improving patients' lives and bridging the gap between secular and religious, Jewish and Arab, Israeli and Palestinian, while fulfilling our dream in our new home. My field of interest is pediatric cardiology. We at Tel Shomer take care of infants and children from Israel, Palestinian territories, and as far away as Iraq through the Perez Center for Peace. Differences between practicing medicine here in Israel and America are primarily economic. In America, the economic model is fee-for-service with reimbursement performed by either insurance, Medicare, Medicaid, or self-pay. In Israel, the economic model is social medicine with every citizen belonging to a health fund. Physicians in Israel are unionized and are paid by the hour. That took some getting used to. The level of care and technology of medicine in Israel is quite high, and we have all the latest equipment at our disposal. It's really nice to make medical decisions based on the patient's needs rather than their ability to pay. At the end of the day, we're here to practice medicine on all patients regardless of their religious background, ethnic origin, or their ability to pay. And that's really what it's all about. Oh, and we get to live in Israel too.